Anxiety is a part of the cancer experience, but it doesn't always show up the way you expect. In this episode, we're joined by Dr. Tracey Murry, a clinical psychologist who works with people facing cancer. We talk about the full spectrum of anxiety, from everyday worry to panic, and why naming what you're feeling can be the first step toward healing. Dr. Murry shares practical tools you can use right now, and we explore what support really looks like for patients, caregivers, and loved ones. This is Kidney Cancer Unfiltered, and you're listening to episode 7. Well, Tracey, thank you so much for joining me on the podcast. For our listeners who had not had the pleasure of hearing you at our New Orleans event, could you introduce yourself and your background and why you're here and all that stuff?
Absolutely. I'm Dr. Tracey Murry. I'm a licensed clinical psychologist. I work exclusively with the MD Anderson Oschner Cancer Center, and we provide care to patients who are diagnosed with cancer, undergoing cancer treatment, who are in what's technically called survivorship, and family in their support system. So all phases of treatment we treat to kind of help them and provide support with them through their treatment process.
Wonderful. So I mentioned the New Orleans event, and there you were talking about anxiety. And I know our listeners, and myself included, always want to know what to do to help with our anxiety. But before we even go into solutions and strategies, I'd love for us to kind of talk about the different ways anxiety shows up and the different types of anxiety. And so this is going to be a long-winded question because I'm going to throw some things in there about me. Like myself, before cancer, I had anxiety. I dealt with anxiety. It's treated through meds and other things and journaling and whatnot. But for like cancer-related anxiety just seems to be very much a different beast. So could you explain the difference between, I don't want to say everyday anxiety, but for the purposes of this conversation, everyday anxiety and cancer-related anxiety?
Absolutely. I'll start kind of with the basics and how anxiety can develop. So most historically, we talk about the biopsychosocial model of the approach to anxiety. So the biology that's related to it, the psychology that's related to it, and the social. So some people are just what we call predisposition for anxiety, like biology, or they go on later in life to develop anxiety because of some biological concerns, changes in your thyroid, hormonal changes with menopause, pregnancy, men when their testosterone changes. So we have that biological component. The psychological component can be broken down into what happens in your body and your brain. Again, depending on who you listen to, this can vary.
Yeah.
So the thoughts that's related to it. So those worrisome thoughts, and then anxiety as it comes out in the body, meaning the heart palpitations, the kind of jitteriness, physical tension in your body, and relational anxiety. So avoidance of things.
Right.
And then we have the environmental. So something outside of you is causing that anxiety to come up. Loss of a loved one, work stress, medical stress, all these things. And when we think about cancer-related anxiety, it's kind of a little bit of every one of those.
Yeah.
So I think that's what makes a difference as opposed to just being work stress. You just have that external thing that's impacting you. Whereas when we talk about cancer, it can be the biology. Your body's not doing what it needs to do usually. It can be the psychology, the worrisomeness are coming out in your body. And it can be the environmental finance, especially when we're talking about cancer and financial toxicity. So that's kind of the basics in what we think about it. I also too think about cancer-related anxiety on a spectrum in terms of severity, right?
Yeah.
We talked about this as at the seminar. So the first part is what your general low-level anxiety, the day-to-day things.
Yeah.
That feels quite differently, how it comes out of you, and how we treat it is quite differently than your next stage, which we think about as distress, meaning everything is amped up. The way in which you treat this kind of distress, meaning that 10 out of 10 scale, everything seems to be falling apart, your ability to bounce back from that anxiety might be a little tougher. So how we treat that is quite differently. Then we have more of panic, right? So
Mm.
panic attack, panic-like symptoms, or panic disorder, we have brief periods of time, usually about 3 to 7 minutes or so, where you have some very intense or severe physical symptoms in mind that almost seems out of control. So the way we treat each of them can vary in terms of management. If you try to treat general anxiety, day-to-day situational anxiety, those coping skills with the panic might not quite match up because they're so different. What's happening in the brain and body, how you're taking in the world around you changes.
So before I get into my next question, I do want to say when you said the thyroid, so I don't, I believe I mentioned this at the seminar, but I'm also a thyroid cancer survivor. And so I lost my
Mm-hmm.
thyroid, had to go on Synthroid on a pretty high dose just to suppress. And there was a period where I felt anxiety in a way I never had felt it before. And then I was talking to my therapist. She's like, it's probably because like you're hyperthyroid. And I'm like,
Yeah,
oh, and I just say that to say, like, there's so much in us that can cause these feelings that we just don't even realize. So
right.
that's just a little aside. But I did going to like the spectrum of cancer-related anxiety. I'd love for you to kind of give examples, maybe of each one that you've described, of how it can show up for people.
Right. And I want to mention too, now that we say about the thyroid and the biology, a lot of times when we have these symptoms, we blame ourselves, right?
Yes.
Saying, why can't I control this? Why this
Yep.
is happening? If you have trouble with your thyroid or even what's called Graves' disease, it
Yeah.
feels like a perpetual state of a panic attack.
Yeah.
It's not anything you've caused.
Yeah.
It's purely biology. So when we think about these things, I don't know why when we break our leg, we can pretty reasonably reconcile that we need help with that. But when we have Graves' disease and then having all this anxiety, we take it in as being something about ourselves, right?
Yeah.
That some sort of way we should be able to fight through this or warrior through it or something like that. When that's not the case, right?
Yeah.
That's why you got people like me, and people like endocrinologists
Yeah.
who help with thyroid functioning. But on that spectrum, that low level anxiety could be or worries, it just depends on the person. All these day-to-day things like, all right, I got to take my medicine. Okay. I have treatment coming up. I've been in treatment for a long time. So it's okay. Generally, people at this stage don't have anything new coming up, right? They're
Yeah.
kind of already in the groove of things. They're actively in treatment. They've been in survivorship for quite some time, and it pops in and out, pops in and out. When we talk about creeping up on that spectrum into distress, I see the most distress and even panicky symptoms in periods of transition during
Mm.
cancer treatment. That means when they've first gotten their diagnosis, when they're beginning to start treatment, when they're ending treatment, and or when they're going to surgery, or when they're finishing the full treatment process. So when things change, right? It's kind of a shock to you to say, oh my God, I've gotten used to it now. What is next? So
Yeah.
that can cause different levels of distress. You feel it in the body, your thoughts may race. You may have trouble with sleep. It's harder to manage with your tools. You may have worries that kind of loop around, like on a hamster wheel. Or if it's coming out in your body, you may feel the heart palpitations, just kind of general unease, fatigue, because anxiety wears you out, right?
Yes, yes, it
And
does.
then relational, you might avoid people, you might not talk to people, you actually might retreat into yourself,
Mm.
abandon coping skills, things that work for you in the stage, because again, it's like you're trying to transition. Some people may feel that type of distress too, when they're coming up on a scan, a doctor's appointment that they haven't been to in a while. That's called anticipation anxiety. People call it scanxiety.
Yeah.
But it's basically the anticipation of something coming. And that anxiety responds only to really distractions, because that feeling won't go away until you overcome the thing that's causing the anticipation, right? Until you have your scan and get the feedback. Even if the feedback is not the feedback you expected, you can
Yeah.
manage that better than you can just the anticipation phase. The body does something differently. When we're talking about panic, sometimes panic can be anticipated, expected, or not. Let's say you have a deep fear of the MRI. I expect you to be distressed going into it. You may have a panic attack while you're in there. For other people, it just comes on them, kind of like the water being full because of all of this other type of
Mhm.
stress, and the one thing just tipping you over. It can feel like in the mind, kind of craze, like, oh my God, am I having panic? I'm feeling anxiety. Oh my God, what's happening? It can feel like, where am I? Some people might not feel connected to their body. They may
Mm.
feel this wave of heat or feeling like they're going to die, feeling suffocating. Some people shake, sweat, trouble catching their breath, feeling like they just got to get out of their skin, but it
Yeah.
only lasts a short period of time. Then, when that period of time, about 3 to 7 minutes or so, is ending, they're exhausted. That's because the part of the nervous system is amped up, thinking you either need to fight, flight, or freeze, right?
Yeah.
Because it's thinking you're in danger in some way when realistically you're not. It's just the way your mind has learned to deal with very distressing situations.
You gave so you gave a few different examples that in my head I'm going, huh, so that's where it would fall in the spectrum, like things that I experience. And I think that I say that to say, I think as a society, we have these misconceptions of how like anxiety presents itself, right? I think there's this misconception that anxiety is always like very panicked, racing thoughts, all this stuff. When you made you gave the example of like kind of retreating into yourself, and like for me, that's always been like a sign of burnout and depression, but I never connected it to anxiety.
It can.
Um,
Uh-huh.
and I was just gonna say another thing, like whenever I'm doing I'm not now, but like whenever I'm doing new presentations, I have the same thing. I get very sweaty, I get shaky, and it comes off. And I never thought of it as like a panic attack. I just thought, oh, I'm afraid of public speaking. What are some of those misconceptions about anxiety that you've heard or that you know that we have?
Yeah.
And how can like we kind of reframe them, if you will?
I think the biggest one that I have is using anxiety as a scapegoat. That's probably the biggest sort of, as a provider and as
Yeah.
people who see and try to work through a person's with severe unmanaged generalized anxiety, post-traumatic stress is an anxiety type of disorder, OCD and so on, and just your general health or illness anxiety. When a person is trying to use the anxiety to make bad decisions,
Mm,
to treat people poorly, or to
mm,
get out of accountability, is where the misconception happens. For example, if you say, well, I have anxiety, so I can't come to work. Like,
mm.
is that true? Or are you
Yeah.
trying to scapegoat anxiety because you don't want to work? Because
Yeah.
I've seen instances where a person's anxiety is so severe they can't get up out of the bed because they're debilitated.
Yeah.
But to use that inappropriately really makes it harder for the people who are actually dealing with the significant amount of anxiety, right? Anxiety in that severe form is actually pretty low rates. So, you
Yeah.
hear quintessential things like on social media platforms, but oh, I can't do that, my anxiety. That's really a inappropriate use in
Yeah.
terms of anxiety. So when we think about anxiety, there is a level of awareness that everybody has. If you
Yes.
didn't have awareness, you wouldn't get up and do anything.
Yeah.
There is majority of the people fall into, I would say about 70% of people fall into this mild low level anxiety. That's awareness that
Yeah.
gets you going. It's on your mind, but I wouldn't necessarily call that anxiety per se. And then on the other end of this curve, it's people with this debilitating anxiety. So simply because you feel or have worries for things in your body does not mean it's debilitating you. So I
Yes.
think
Yeah.
that's where people have the most misconception about it. It's simply because you have it, you can't function in society. When that's more of a personality issue as opposed to what we call pure anxiety, right? Because we got to go to work. If you didn't have awareness that you have to pay your bills,
Yeah.
you can pay your bills. But if the concept of paying bills and going to work prevents you, it's in your body, you're stuck or you can't. That's quite different than just saying I have anxiety. So I
Yeah.
think misuse of the term itself to describe what's going on right now in this society, I think is one of the biggest misconceptions and misuses of the word.
That's funny. It's not funny in that, but more funny in using the term because I remember when I was younger and it stuck with me. I had a health teacher who there was a kid who's like, I'm depressed, and she stopped them and it's like, are you depressed or are you sad? Like, have you
Exactly.
been sad for 2 weeks or more? Or are you just sad over one issue? Like, let's not. And I think that's very important and something I've talked about like misusing terms and kind of using them as buzzwords when really like it can continue to stigmatize things. And I think especially within cancer where you and I'm sure you've heard survivors say it. I know if I heard survivors say it, I know I say it too. There is this pressure to be strong, to be grateful, to not show as if cancer is bothering you, to be this inspiration, to like push through and be resilient. That all those feelings that you may be having, whether it's like panic or just mild distress or whatever, anything that doesn't like fit into that narrative, you feel bad for. And so you shove it down and becomes worse and
Exactly.
perpetuates. And so like it just ends up, I think, continuing to kind of stigmatize that. And so if I'll pull on that thread a little bit more regarding like anxiety being stigmatized among cancer survivors, particularly.
I think the difficult thing is if everyone has the potential to have anxiety, which I said, there's
Yep.
every, how is it wrong? If everyone has it, how
Yeah.
is it wrong? You have an eyeball, you have a heart. Is it wrong when it beats or blinks? So when we think about how we view emotionality in general, right?
Hmm.
Depending on how you were taught emotionality, what society you're in, people can see that. But what I'm saying, anxiety and emotions are just energy. They
Yeah.
have to leave the body, like urine. You got to pee, right?
Yeah.
And if you don't, you're going to get a urinary tract infection. So
Yeah.
without the expression of emotionality, that leads to the depression and the more serious forms of anxiety. When we see it as a strength, because you're a human being going through something tough. My thing is feel the feels, but don't live it.
Hmm.
Let it come and then let it go because it has to go somewhere.
Yeah.
And when you really think about strength and all that, you don't have to feel strong. You don't have to feel any particular way about getting through it. I think it takes a more strong person to acknowledge when they're having something going on and to seek out assistance. It's easy to avoid.
Yep.
That's why people do it. It's very
Yeah.
easy to avoid, very easy to stuff down. So if we're thinking about it, that's the opposite of strength as it presents. When you say, I need help, that's hard to do.
Yes. Thank you so much for saying that because that's something I like. That's part of the conversation anytime I have with other people about, especially around resilience. And this was a comment I had made the other day watching a seminar, a webinar on resilience. It's like sometimes resilience means letting go. It doesn't always mean pushing through the challenge, right? Because you might be pushing through the challenge for very toxic reasons because you're pressured to, and it leads to more stress and more burnout and worse feelings. Sometimes just being able to be like, no, I can't do this anymore is actually the most resilient and strong
Or
thing you
even
can do.
I'm not meant to do this.
Exactly.
Right? So sometimes when we are saying, I often tell my patients that this is not a thing that is meant for you to do. Meaning, if you do it and don't succeed, you're not a failure. It wasn't even a good fit in the beginning.
Yeah.
Right? So when you're trying to manage, you're trying to put on this air or this mask of strength. It wasn't meant to be that way. That's why it's not working. That's why when you go to the grocery store and see a pretty apple, you fall apart because all the emotionality
Yes.
was built up in there.
Yep.
It wasn't meant to be that way. So when we think about emotionality, it's actually the opposite of the way we think. It has to go somewhere.
Yeah.
It was not meant for you to do. So when you say, I'm falling apart, I'm a failure. No, you wasn't even meant to try and hold it in the beginning.
Yep. No, you're 100% right. And I think that mask of strength is something many cancer survivors are wearing, right? And so how can we what are some strategies for us to kind of let down that mask, right?
Right.
Therapy is always good, counseling is always good, but starting with
Yeah.
ourselves, what are some strategies that we can do?
I think the first part is acknowledgement. It's just to seek out, reflect, to know what's going on. So
Yeah.
if we don't know what's going on, we don't know how to manage it. seek out social supports, even if that support looks differently in different ways, right? Also, know the people around you. If they're not going to add to you when you're going forward, you have to reclassify them, is what I say.
Yeah.
That person may not be the person to talk to or support you, but they can go get the bread from the grocery store and drop it off. Okay.
Yeah.
And that may be all they need to do. Coping skills and strategies, basic fundamentals, making sure you're eating, showering, brushing your teeth, getting physical movement. And I say physical movement, just moving the body
Yeah.
around, doing things that you like to do, being around others, but also experiencing solitude, which is quite different than isolation. Solitude is
Yes.
helpful in replenishing. Isolation takes a lot out of you. Because honestly, those basic needs are the first thing that goes whenever we're dealing with a new stressor or increased stress or trying to manage this idea of strength, right? You're trying to put on this face and then you're so exhausted, you didn't even eat today. You didn't even move your body today. Did I? Something about brushing your teeth just changes your life, right? Brush
It
your
really does. It really does. Like there are days that like where my depression is in a space of like funkiness. And I know like this is a day where I am not like getting ready. Like I'll work, but like I'm not gonna have meetings on my calendar. I'm not gonna get because I need that. And so that and I say that to say like those are days where I'm like, I'll brush my teeth at night. I'm gonna be gross. Like that's what I need. But yeah, then there are other days where I'm like, no, I'm gonna brush my teeth. I need to do something. I need to
It's like this.
feel something.
Well, I'm telling you, it's something about it that
Yeah,
changes your whole life. But because it's a basic need, you
yeah,
can't even think of these higher order things if you're hungry. You
yep.
can think of these higher order things if you got to go to you ever try to talk to somebody and got to go to the bathroom?
Oh
You
my
don't
God,
know
it's the
what you
worst.
tell them. And then you come out of the bathroom having used it, and you're like, wait, what did I say? That was wrong. Because your brain can't manage the taxing of what it needs to function and survive. Can't even think about that other stuff. So when we're putting on the mask, when we're trying to manage anxiety, if we're not tending to what our physical human body needs to function, everything else will fizzle out. A car can't go without gas and oil change, right?
100%.
How do you think it's going to get over the potholes in New Orleans if it's not even getting what it needs to get to run?
Yeah, and it's sad because I see it on so like people make the comments all the time, right? Like about like mental health versus physical health. And it's like, we wouldn't say to someone with diabetes or some other condition, oh, just get over it, right? But people dealing with anxiety, cancer-related anxiety, or otherwise dealing with depression or anything else, PTSD, there's always this like, get over it. And it's the same thing, especially cancer survivors. I know that they've heard that stuff. Like, it's like, just get over it, just get over it. And it's not easy to just get over. And then when you're feeling forced to get over it, it just gets worse.
It's not even meant to get over. There's nothing to get over, right? You had an experience that may have changed you in certain ways.
Yes.
We're assuming that the anxiety and the mood, again, and the emotionality coming out of a diagnosis is bad when I'm saying it's appropriate.
Yeah.
So it starts in how we're looking at and perceiving psychological mental health responses to a thing. If we as a society saw that, of course they're going to cry when they do that. Of
Yeah.
course they'll be worried when they do that. When it happens, it's not a sign of weakness. It's a sign of strength because you were supposed to do it, right?
So then so we talked a little bit about the self strategies, which I would love to get more into, like more tactical, but what what do our loved ones need to know? Right?
Right.
Because a lot of it is like that external pressure. It's not just our internal pressure, it's that external pressure. It's
Right.
our support systems, it's the people around us, it's even, the support system behind that. How can they support cancer survivors better who
Right.
happen to be experiencing these emotions?
I think it depends on the person and the dynamic of the social situation. I will say that because not just because people are there, what they can do and how they support you can vary. For family, I want to say know your lane. That's just immediately came out of me. Know what you're good at and what you're not good at. If you are the one when you try to provide verbal support and it causes anxiety in the person you're trying to support, that might not be your lane, right?
Mhm.
So know your strengths in terms of how you can support people. If you are not one to say things in the right way, it's just going to come out wrong. Maybe you need to be a doer and not a sayer. Maybe the questions, tell me 3 things you need today. That's your role. If you're a great hugger, give the hugs, right?
Yeah.
So it really depends on the strengths of that person and the needs of the survivor. Again, if it's not your strength, when you provide that thing to that person, it might not land how you need it to land, right? If it's not your strength, you get there and the person is falling out crying and you stop that. That's not going to be helpful for that person. So you know what? You call the person that can provide the comfort and you go get the milk. You know what I'm
Yeah.
saying?
Oh, I 100% know what you're
Right.
saying. Yeah.
And knowing too that we through diagnosis we get an abundance and a surge of support, right?
Yes.
After it's said and done, that support kind of takes a leap down, knowing
Hmm.
that it doesn't end just with the ringing of the bell or the completion of surgery or your last radiation treatment. It doesn't necessarily end there. Check on your people.
Yeah.
Just check on. Because you know that when we're at diagnosis and through treatment, you got this volley of people, but then it dies off with the idea that, oh, they're done, they're fine. Right.
Exactly. It's that
So
they're
check
fine.
in on your people because that just is the beginning of the recovery road, right?
Hmm.
Your body and brain trying to find themselves. You're trying to get back to some semblance of normal. Or if you can't get back to that normal because you're metastatic in nature, you're trying to create a new one. So if a couple of weeks go by, oh, just check in on them. Hey, just checking in on you. Just let them know that they haven't been left alone simply because they are done with the core portions of treatment because those scars are still there.
Yeah. Thank you for saying that. I feel like I know, not I feel, I know that that is something that even cancer survivors like convince themselves out of, right? Like I was on a podcast recently and I was asked to define survivorship in one word and I chose traumatic because like you go through cancer, you go through the diagnosis, that's I want to say in a lot of ways easy. It's not, but it's easy in terms of like, okay, you know you have the cancer, this is your treatment, you're done, right? With that active part of treating your cancer if you are not metastatic. But then there's everything else after. It's the worrying about what your body's doing to you, it's the anxiety, it's just existing through, well, what does a life as a cancer survivor mean to me? Especially if you have another cancer or a recurrence or precancerous cells or whatever it may be. And this goes into my next question. You had earlier mentioned post traumatic stress. And
Mhm.
so I would love for you to explain a bit more for our listeners how post-traumatic stress sits into this anxiety conversation, right? And the difference between like post-traumatic stress disorder and post-traumatic growth and how all those terms and all those
Yeah.
things fit together.
Yeah. So what we call PTSD or post-traumatic stress disorder is an anxiety disorder by nature. A few years ago, it was underneath the anxiety spectrum, but they pulled them out. I want to have a disclaimer too that not every stressful thing that happens to you causes or can lead to post-traumatic stress. Some things are stressful, some things are distressing, but not everything is traumatic. We have a full criteria of what could be considered traumatic because your brain and body responds to these things quite differently than if the thing is just stressful, right?
Yes.
Or just distressing. Having cancer is one of those things that we can consider a serious medical illness that we can consider that can lead to post-traumatic stress. About, I think the stat now, I don't know the stat for 2024, but when I did this talk another time, upwards of like 80% of people across their lifespan experience what we call a traumatic stressor. That doesn't mean everyone who experiences trauma goes on to experience post-traumatic stress disorder. Only about 8 to 10% of the people exposed develop PTSD. Okay. So when we think about it, a serious medical thing really happens because the concept of your life and dying and fear out of control, it can change the way you see yourself, others in the world. It can make things happen in your mind and in your body to respond to these viscerally. Okay. Uh, PTSD in general with this society is bastardized. Everybody thinks they got it when they don't, right? Because most people, of the people who experience the trauma, within about 3 months or so, they remit. They go back to what they were just fine. Because you have to have symptoms of PTSD for about a extended
Yes.
period of time. So you can have a stress, you can have a trauma, but most people bounce back from it. For those who don't, generally go on to experience a lot of different symptoms from that. And that requires like formal assessments. The cancer is one of them. I've seen it. And the way we treat those things is what I would say the top 2 or 3 ones that I like to use is cognitive processing therapy. It really tries to adjust how you see yourself, others in the world, and there's an exposure piece to that. And then there's prolonged exposure. Let's say your core trauma throughout your cancer treatment was when you woke up during surgery, right? When you woke up and you smell, like I've had people say the smell of the blood, me waking up that's traumatic, right?
Yeah.
And it's tied in. So what you would do is their physical response to that is so heightened. They may avoid a lot of things. So you want to begin to expose them to that and to that memory in a very strategic way so those symptoms come down. And then some people use something that's called ACT, or acceptance and commitment therapy, which is, all right, this thing happened. How do we move forward? Basically, how do we accept that this happened and commit to ourselves in well-being and recovery to move forward that leads to the post-traumatic growth? Out of this terrible thing, you've grown and you've seen yourself and you're able to bounce back and go on and flourish. That's the simplest way I can explain it.
Yeah.
Right. But again, many people experience a trauma. Not very many people of that go on to develop PTSD. Cancer is one of them. Let's use it when it's appropriate.
Just a side note, I did CPT for a different event that I was diagnosed with PTSD for, and I will say, if our listeners want to try it, it was a very helpful therapy, and there's a lot that you can take away with it, like from it, that you can use in your daily life, especially in journaling. I bought this one journal that's like specific to anxiety, and it's a lot of like CPT kind of
Yeah.
work, and I just wanted to give a plug for it for
Yeah.
our listeners who may be looking for different kind of treatments. But I want to go back to strategies and coping strategies. What are some like tactical things that people can do?
Yeah. So I will talk in that spectrum, right?
Perfect.
So the low level day-to-day anxiety, deep breathing, exercise, making sure your nutrition is good, getting time outside, so limiting isolation, thinking about how you think about things, balancing the what we call unhelpful thinking with more neutral or helpful thoughts, having people that you perceive that you can rely on. So you're treating the brain, body, and the environment, like I talked about before
Yeah.
in biopsychosocial, right? So those are some of the quick strategies. Some people journal to get their thoughts out, especially if, and I wouldn't even call it journaling as opposed to documenting, because it doesn't have to be coherent sentences.
Yeah.
If you have a thought that's swimming in your mind, you can say, worried about my skin, and just put it down there,
Yeah.
right? So the basis is breathing, time outside, exercise for treating the brain, the body, and your social environment, having people around you that can distract your mind. Distress is more the elevated and amped up version of that. Depending on where we are, we want to investigate what's causing the distress. If it's coming up on the scan, distractions. If it's anticipating fearing what's going to come out, we come up with strategy and balance. All right, if this does happen, what are we going to do? How do we push through the fear and come up with some sort of solution for it? And with those low level things in managing anxiety. When we talk about panic, or even if it's not a full blown panic attack, if it's hovering between the distress and panic, you have to first calm the body down, right?
Yes. Yeah.
I like to, there's this skill that's in dialectic behavioral therapy. There's a chapter of that called distress tolerance. Cold water therapy really works if you're cold tolerant, if you can do
Yeah.
cold. So basically, when you're in this high distress and panic, the part of your body that's controlling your senses and your nervous system is amped up with a bunch of chemicals that's making you fight, flight, or freeze. If you do cold water, putting ice on your face, sometimes people have to put their head in an ice cold bucket of water. Sometimes people have to jump in a cold shower, stick your head in the freezer, hold ice cubes. That sends a shock to the body to tell the body, all right, we're no longer in danger. Come on down.
Yeah.
All the other strategies for that low level and distress won't work without doing this, or it'll be difficult. Then you can go ahead and do the breathing and then the muscle relaxation and all the things he mentioned. For some people, if they don't have access to cold therapy and they, I'm gonna say, are fit. Now, don't do this if you're not used to doing it.
Mm.
Really intense spurts of exercise can help.
Yeah.
You have to be panting and sweating. So if you're very fit, your usual regular thing won't work. We talk about intense exercises like a sprint for a short period of time where you're giving it to the max.
Yeah.
That will expend that energy, like I talked about. So we either shut it off with the cold therapy or expend it with the exercise. But for my cancer patients, just depending on where they are, sometimes I don't recommend that one because they in treatment. So I grab a couple of ice cubes, baby.
Yeah.
And then with that distress, you do the low level things like breathing, getting out of the space, time outside, spending time doing great things, even if you don't want to, and so on and so forth.
Now, we talked about awareness and like understanding what we're experiencing. What are some ways people can recognize the symptoms that they're experiencing? Because again, like retreating into yourself, someone may not realize that that is actually what they're doing. So how can people understand their symptoms or like
Mhm.
acknowledge what they are?
I think first is education. Mayo Clinic has quite a good bit of information on symptoms of anxiety and what to look for. And
Okay.
what I would say too is grab a loved one and teach them those symptoms too. Because if you're in high level of panic or distress, you may not even recognize it. If you're ruminating, some people stare and they're stuck. But if
Hmm.
you have a trusted buddy who knows that these symptoms are come on, they can take, go do your thing, right? They
Yeah.
can tap you, you're doing that thing again. Oh, I didn't even know, right?
Yeah.
So knowing what the symptoms are, having a buddy and having someone recognize them and even having a plan. So sometimes I do this thing called a coping card or just a coping plan, where if you're in such a distressing space or even low levels anxiety, before you're in that space, you say, all right, I'm gonna do 1, 2, 3, 4, and 5 if I'm having panic. So that way, all you got to look at is the card. You don't have to figure out what to do,
Yeah.
right? Especially if it's the physical symptoms. Number one, grab ice cubes. All right, that don't work. Number two, drink some cold water. Number three, if it's cold outside, and then you jump in the cold shower. So
Yeah.
you have these things already listed out and you have a plan. Sometimes simply knowing you have the plan helps,
Yeah.
right? Just knowing that, oh God, I'm gonna get to this space and I'm not gonna have nothing to do and I'm gonna die because panic attacks feel like you're gonna die.
Yeah.
Sometimes just knowing it and you look over there at the thing and you're like, oh, okay, I'm good. Even if I get stressed out, I already know what I'm gonna do.
Yeah.
Yeah.
I think that's it's such good advice. I think we can so underestimate being prepared as a coping strategy in and of itself. And I've said, I believe I said this on the podcast before, but with my ADHD, I get, the hyper focus. I know that if I don't have my meals prepped, I'm not eating during the day because I know I'm going to be too into work and I'm not going to want to cook and I don't know what to cook. And so like even if it's so much work on a Sunday, I'm like, I know that in order for me to eat, I need to prep my meals. And I say that to say it's like those simple things of just preparing yourself because you know how you are otherwise
Mhm.
really can like lift so much anxiety. So I love the idea of like a coping card. It's just a
And that's how you
preparation.
can have the loved one help you out too. Like when you say, but again, know your loved ones, right?
Yeah.
Use the one that's more helpful. Come on, help me make a coping card so they know what to do,
Yeah.
right?
And I love that piece of advice too. And it just makes me think about me and my partner. There's something that he does when he's having a bad memory that's like causing like kind of just really quick low level anxiety. He'll take this breath in. And so like when I hear that breath, I know I'm like, oh, did you have a bad memory? And he doesn't tell me the memories, and I get it, that's him. But
Just to
like
bring
just
you
even
back.
being able to recognize it, it's like, okay, we're in this space together and I know where you're at. So I think that's such great advice that I didn't even think about giving, just because it's just something you learn to do, I suppose, when you're someone's like partner or family member. What are some other things, because I know we have about 10 minutes left, what are some other things that we need to know about cancer related anxiety that, maybe in it we just don't think about?
Simply because you have anxiety, let's say you're in the survivorship space. Simply because if you have a scan coming up or a doctor's appointment or a lab and you have anxiety, doesn't mean you're not healed, right? You may, for the course of your life, every time something comes up, have that anxiety. As long as when the thing is done, you're back to your regularly scheduled program,
Yeah.
then you're cool. Now, if it's debilitating, where you're avoiding, or even after it's done, you're not even believing what the outcome was, or you're just taken down, that's when it's time to find somebody like me. But if you have, oh Lord, I'm nervous about this scan, you go in there, get the results, okay, cool. You're bouncing back, then that's good. Don't expect to not have any anxiety. Because again, that's not realistic. If you did it, I'll be having another conversation. We'll be having another
Yeah,
conversation.
absolutely. I did want to actually ask, when should people consider professional help?
Mhm.
Because again, going back to that whole wearing the mask of strength, denying it, compartmentalizing, you don't want to take that step. But like, what do people need to know? Or like, what are the things they need to keep in mind where it's like, it is time I turn to somebody?
I think if you've never had an experience like this and you don't even know what to do to cope,
Mm,
it's good to talk to someone, even if it's just for a couple of appointments to get those stress management skills, because you don't know, I've never had to encounter anything like that. If the skills that you use normally work and they're not, come see us. If you have very limited social support, like you can't even identify the people to help you out with anything, come see us. If you're having, if your anxiety is coming out in ways that's impacting you, you're having significant trouble sleeping, nightmares, high blood pressure can be a
mm.
sign, or you're just not feeling like engaging with the things that you usually do, come see us. So you can see someone like me for prevention. Sometimes I see people for 1 or 2 appointments, then they're good to go.
Yeah.
Sometimes I see people when they're deep in it and they need a little more. Sometimes I see people at the end of treatment and they just want to know how to transition out. So I think there's no limit, especially what you can use us for, even if it's not something that you're generally thinking about.
So we know that mental health in America, the support, the counseling, we don't have enough of it, especially social, like oncology social workers, we don't have enough access to it. So, and I believe the stat is like maybe 5% of people who have cancer related distress actually are able to get mental health help. So, for our listeners, where can they go in terms of like resources to find counselors, to find someone to talk to, like free services, if you will, maybe, or just online services, whatever you have, what resources can they turn to?
I think cancercare.org is a good resource to kind of see what's going on. And also the Association of Psychosocial Oncology, APOS. It's where all the mental health providers we meet for conference, and they have a directory of providers that you can search by region, state, and stuff like that. Cancercare.org has support groups, and they're actually led by social workers, online platforming. You can also go, if you can't find the specific cancer psychologist, you can go to SAMHSA website, and it's SAMSHA, and find local providers.
And just for our listeners, that's in addition to like places like Kidney Cancer Association that has like support groups and patient perspectives and like caregiver groups. Now, I want to give you time to share anything that maybe we didn't touch on, I didn't ask about, that you think is really important to drive home in this conversation.
Again, I think it's okay, whatever phase you're at throughout this process, don't feel like it's nothing you can come back from, especially if you're feeling alone and isolated, if the anxiety is overtaking you, we can come back from that, right? And then we're going to get you to a good place where you're going to fly off birdie and go live your life. So don't think because you've had cancer, because you experience anxiety, because you experience some sort of thing, doesn't mean you can't come back from it and live your life to the greatest potential it can be.
Well, thank you so much, Tracey, for joining us. It was an excellent
Sure.
conversation. I know I'm taking away a lot that I need to apply to my daily life, and I hope our listeners do too. I think the underlying message for me, too, in addition that we can bounce back, is that we don't have to wear that mask of strength.
Nope.
Like, there's no requirement. No one's better than us because they feel like they've gotten over anxiety. Like, it's our own personal experience, and it's real, and we can have it, essentially.
Yeah, absolutely.
Well, thank you again.
Thank you. So glad to be a part of it.
Thanks for listening to Kidney Cancer Unfiltered. If you found this episode helpful, be sure to like, share, and subscribe wherever you listen to your favorite podcast. For more resources and episodes, visit kidneycancer.org or follow Kidney Cancer Association on social media. Until next time, take care, and remember, you're not alone.